Assalamu alaikum. Auzu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Now I would like to discuss about the drugs, antipsychotic drugs. First of all, typical antipsychotics, first generation antipsychotics, health tries to fly high, haloperidol, trifluoperazine, fluphenazine, thioridazine, chlorpromazine, also pimozide. Actually, I forgot these drugs, this pimozide. These are the first generation antipsychotics. Haloperidol, IV, or IM can be used. Very good drug for acute psychosis. Atypical antipsychotics are second generations. Aripiprazole, acinapine, clozapine, olanzapine, quetiapine, iloperidone, paliperidone, risperidone, lurasidone, ziprasidone. These are very good drugs. Olanzapine may cause obesity. Risperidone can cause hyperprolactinemia, and clozapine can be used in um, clozapine can be used in the case where two antipsychotics fails to work, usually used in schizophrenia. Uh, okay, mechanism, it block D2 receptor, it block dopamine receptor, increase cyclic AMP, it block dopamine receptor, increase cyclic AMP. Atypical antipsychotic also block 5-HT2 receptor, but aripiprazole is partial agonist. All are antagonists, but aripiprazole is agonistic effect. Aripiprazole is D2 partial agonist used in schizophrenia and Tourette syndrome, and used in schizophrenia with positive negative symptom disorder or with concomitant psychosis, in bipolar disorder, in Tourette, OCD, Huntington. Clozapine used in treatment resistance. These word is high treatment resistant psychotic disorder and those with persistent suicidality. Treatment treatment resistant psychotic disorder and with persistent suicidal activity. Side effects are, in typical antipsychotic, the very important side effect is extrapyramidal side effect, and the most of the question comes from these area. And another side effect is antihistamine, anti-ham, antihistamine, anti-alpha to adrenergic, and antimuscarinic. Antihistamine causes sedation, anti-alpha adrenergic causes orthostatic hypertension, and antimuscarinic causes dry mouth and constipation. It is used with caution in dementia. There may be metabolic effect like weight gain, hyperglycemia, dyslipidemia. Increased risk with clozapine and olanzapine. Olanzapine can cause obesity. Endocrine is hyperprolactinemia like galactorrhea, oligomenorrhea, and gynecomastia. Endocrine is hyperprolactinemia, galactorrhea, oligomenorrhea, and gynecomastia. Cardiac is QT prolongation. Neurologic is NMS, neuroleptic malignant syndrome. Ophthalmologic is chlorpromazine. Chlorpromazine is corneal deposit, and thyroidazine is retinal deposit. Clozapine causes granulocytosis. Monitor WBC closely. And seizures, dose-related myocarditis. And there is extrapyramidal symptom like adapt hours to days acute dystonia, hours to days acute dystonia, muscle spasm acute dystonia, muscle spasm, oculogyric crisis, and oculogyric crisis. Muscle spasm hours to days treatment is benztropine. Treatment is in acute dystonia. Treatment is benztropine and diphenhydramine. In acute dystonia, you can give tetrabenazine also. BD hours to days BD. Benztropine and diphenhydramine can be used. Benztropine and diphenhydramine can be used in acute dystonia. In days 2 months, akathisia and Parkinsonism. In akathisia, restlessness, treatment is beta blocker, benzos, and benztropine. And Parkinsonism in bradykinesia, benzos, and amiodarone. Amantadine and benztropine. Parkinsonism is amantadine and benztropine. In Mahan's 2-year study, Bliss-Kinesia, Korea, special orofacial treatment is benzodiazepine, botulinum toxin injection, valbenazine, and deutetrabenazine. These are the mm, important side effect, experimental side effect for the drug, for the antipsychotic drug. Now, lipid soluble, stored in the body fat, slow to remove from the body. Typical antipsychotics have greater affinity to D2 receptor than atypical antipsychotics, so increased risk of hyperprolactinemia, extrapyramidal. Typical antipsychotic had greater affinity for D2 receptor than atypical antipsychotic. That's why the symptoms may happen that hyperprolactinemia, extrapyramidal symptom, neuroleptic malignant syndrome. And I have already told you about health tries to 5 high haloperidol, trifluperazine, flufenazine, thioridazine, L tries pi, pimozide, and low potency is cheating tips are low. It has chlorpromazine, thioridazine, and prochlorperazine. It has antihistamine effect. Now, lithium affects neurotransmission, decrease excitatory and increase inhibitory, and it works through the second messenger system, G protein couple. Lithium used in mood stabilizer for bipolar disorder. It also treats the acute manic episodes and prevent relapse. The side effect of the lithium is low thyroid, heart, Epstein anomaly, insipidus, and unwanted tremor. Lithium actually excretes through the kidney at the proximal convoluted tubule via sodium channel, and azide, AC, and NSAID and other drugs affecting the clearance are implicated in lithium toxicity. Lithium can cause mild hypercalcemia, it can cause polyuria. That's why there is nephrogenic NDI, nephrogenic diabetes. It can cause Epstein anomaly. It has a very, very narrow therapeutic index. So after giving this drug, all you have to do is to watch the lithium level. For monitoring this drug, you have to see the lithium level. Then buspirone, partial 5-HT1 receptor agonist. It is the agonist 5-HT1 receptor agonist Clinical use is generalized GAD, generalized anxiety disorder. It does not cause sedation, addiction, or tolerance. It does not cause sedation, addiction, or tolerance. Begins to take effect after 1 to 2 weeks. It begins to take effect after 1 to 2 weeks. It doesn't interact with alcohol. It begins to take effect after 1 to 2 weeks, and it does not interact with alcohol like barbies, like benzols. So buspirone, generalized anxiety disorder, it does not cause sedation, addiction, and tolerance. Okay, SSRI. SSRI inhibits 5-HT. SSRI, it inhibits these 5-HT receptor antagonist. It inhibits 5-HT reuptake. It inhibits TCA, SSRI, SNRI, trazodone. It all of them inhibits reuptake of 5-HT. It normally takes 4 to 8 weeks for antidepressant to show appreciable effect. Depression, generalized anxiety disorder, panic disorder, OCD, bulimia nervosa, and binge eating disorder, social anxiety disorder, PTSD, premature ejaculation, and premenstrual dysphoric disorder. All these are indication of giving the SSRI. Adverse effect fewer than TCA, but it has triple S. It can cause serotonin syndrome, it can cause SIADH, it can cause sexual dysfunction like anorgasmia, decreased libido, and this and that, and yes and or. So for SSRI, for SSRI, remember this triple S. That means SIADH, sexual dysfunction, SIADH, sexual dysfunction, SIADH, sexual dysfunction, and SIADH, sexual dysfunction, and the most common serotonin syndrome. Then SNRI, it inhibits 5-HT and norepinephrine reuptake. It inhibits 5-HT and norepinephrine reuptake. These are venlafaxine, desvenlafaxine, duloxetine, levomelasipran. Milnacipran inhibits 5-HT and norepinephrine reuptake. Depression, anxiety, diabetic neuropathy. Venlafaxine is indicated for social anxiety disorder, panic disorder, PTSD, OCD, duloxetine, and milnacipran are also indicated for fibromyalgia. Adverse effect is increased blood pressure, stimulant effect, sedation, sexual dysfunction, and nausea. The most important side effect, it increases blood pressure, sedation, sexual dysfunction, and nausea. Tricyclic antidepressant, amitriptyline, nortriptyline, imipromine, diazepam, clomipramine, doxepin, amoxicillin. These These drugs work just like SNRI inhibits 5-HT and norepinephrine reuptake. MDD, peripheral neuropathy, chronic neuropathic pain, migraine prophylaxis, clomipramine, nocturnal aneurysis, imipramine. The unique side effect of these is triple C convulsion, coma, and cardiotoxicity. Arrhythmia by blocking sodium channel inhibition. Arrhythmia by blocking sodium channel inhibition. Arrhythmia by blocking sodium channel, convulsion, coma, cardiotoxicity, and there is alpha 1 blocking effect like dry mouth, blurred vision, postural hypertension, tachycardia, urinary retention, and tertiary TCA amitriptyline have more anticholinergic than secondary TCS. Secondary TCS, tertiary amitriptyline have anticholinergic, more anticholinergic than secondary TCA. So sedation alpha 1 blocking effect along with triple C's and S in SSRI, sexual dysfunction, SIADH, and serotonin syndrome. Then monoamine oxidase inhibitor, phenylcypromine, phenelgene, isocarboxazide, selazilin. These are the drugs, monoamine oxidase inhibitor. And these are the monoamine oxidase inhibitor mechanism, non-selective MAO inhibition, increased level of amine neurotransmitter, clinical use atypical depression, anxiety, and Parkinson disease. In Parkinson disease, selazilin is the drug used nowadays. CNS stimulation, adverse effect CNS stimulation, hypertensive crisis. This can cause hypertensive crisis. Most notably, ingestion with uh, tyramine containing food. If patient is taking MAO inhibitor and along he is taken tyramine containing food like cheese, then hypertensive crisis may happen, contraindicated with SSRI and TCA. Contraindicated with SSRI and TCA. It is contraindicated with SSRI and TCA. It is contraindicated in the St. John's wort, meperidine, dexmethorphan, pseudoephedrine, linezolid to avoid the precipitating serotonin syndrome. Wait 2 weeks after stopping MAO inhibitor before starting SSRI. You have to wait 2 weeks after stopping MAO inhibitor before SSRI. Otherwise, serotonin syndrome may happen, or stopping dietary restriction. Risk for tyramine induced hypertensive crisis. Risk for tyramine induced hypertensive crisis. Then I have already talked about buspirone or buspirone, then bupropion. This is another very important, very important drug. Bupropion inhibit norepinephrine and dopamine reuptake. It inhibit norepinephrine and dopamine reuptake. Also used for smoking cessation. Bupropion is used for smoking cessation. Adverse effect is tachycardia, insomnia, headache, seizures, and in patients with headache, seizures, in patients with bulimia and anorexia nervosa, decrease risk of sexual adverse effect and weight gain compared to it has decreased risk of sexual side effect and weight gain compared to other antidepressant olanzapine. Sorry, antidepressant can cause weight gain, but these bupropion uh, decrease the risk of sexual adverse effect and weight gain compared to other. It can cause seizures in bulimia and anorexia nervosa patient. It can cause seizure in bulimia and anorexia nervosa patient. This is high yield. You have to remember these thing. Huh. Then mirtazapine alpha 2 antagonist. Mirtazapine alpha 2 antagonist increase release of norepinephrine and 5-HT. Release of norepinephrine and 5-HT. Potent 5-HT2 and 5-HT3 receptor antagonist and H1 antagonist adverse effect sedation increase appetite, weight gain, sedation increase appetite, weight gain, sedation increase appetite, weight gain, and dry mouth. Sedation which may be desirable in depressed patient with insomnia, increase appetite, weight gain which may be desirable in underweight patient, and dry mouth. Uh, primarily primarily block 5-HT2, primarily block 5-HT2, alpha 1 adrenergic and H1 receptor, also weakly inhibits 5-HT reuptake. Used primarily for insomnia, as high doses are needed for antidepressant effect, adverse effect, sedation, nausea, priapism, postural hypertension. Sedation, nausea, priapism, and postural sedation, nausea, priapism, and it can cause priapism. Trazodone is a drug. It can cause priapism. This is high yield. Think trazodone due to sedative and male uh, trazobone due to sedative and male specific adverse effect. Male specific adverse effect. Vilazodone used for major depressive disorder, adverse effect, diarrhea, headache, nausea, anticholinergic effect may cause serotonin syndrome if taken with serotonergic drug. Vilazodone can cause serotonin syndrome if it is taken with other serotonin drug, and 40-oxygen inhibit 5-HT reuptake. 5-HT1 receptor agonist and 5-HT3 receptor antagonist used MDD may cause serotonin syndrome if taken with serotonergic drug. Pharmacotherapies for smoking cessation, nicotine replacement therapy, and varenicline. Nicotine replacement therapy binds to the nicotinic acetylcholine receptor aimed to relieve withdrawal symptom upon stopping smoking. Long-acting patch and short-acting product. Long-acting patch and short-acting product gum lozenges can be used in combination. Adverse effect, headache and oral irritation. Varenicline, nicotinic acetylcholine partial agonist. Nicotinic acetylcholine partial agonist. Diminished effect or on reward system, but also reduces withdrawal. Adverse effect, GI discomfort, sleep disturbance. Varenicline helps nicotine craving. Varenicline helps nicotine craving decline. Medically supervised opioid withdrawal and relapse prevention. Injection drug use or increased risk of hepatitis B, C, HIV, skin and soft tissue infection, bacteremia, and right-sided endocarditis. Methadone, long-acting oral opioid use for medically supervised opioid. Long-acting oral opioid used for medically supervised opioid, heroin withdrawal, and long-term maintenance therapy. Buprenorphine partial opioid agonist. It is used in sublingual film to suppress withdrawal and for maintenance. Partial agonist can precipitate withdrawal symptoms in opiate dependence individual when administered slowly after a full agonist. Naloxone short-acting opiate antagonist given IV, IM or nasal spray to treat acute opioid overdose. In acute opioid overdose, This naloxone is used in acute opioid overdose. Naloxone is used. Naltrexone, long-acting oral opioid antagonist, used after detoxification to prevent relapse, may help alcohol and nicotinic cessation, weight loss. And that is all about the psychiatric drugs. Now I would like to discuss a little two things. These two things, the psychotherapy and CNS, central nervous system stimulants. Psychotherapy is behavioral therapy, teaches the patient how to identify and change maladaptive behavior or reaction to the stimuli. Systematic desensitization for specific phobia. Cognitive behavioral therapy teaches patient to recognize distortion in their thought process, develop constructive coping skill, and decrease maladaptive coping behaviors, greater emotional control and tolerance of distress. Dialectical behavioral therapy designed for use in borderline BPD, in borderline personality disorder, but can be used in other psychiatric condition as well, like depression. Interpersonal therapy focused on improving interpersonal relationship and communication skill. Motivational interviewing enhances intrinsic motivation to change by exploring or resolving ambivalence used in substance use disorder and weight loss. And supportive therapy utilizes empathy to help individuals during a time of hardship to maintain optimism or hope. Central nervous system stimulant methylphenidate, dextroamphetamine, methamphetamine, dextroamphetamine. Mechanism increase catecholamine in the synaptic cleft, especially norepinephrine and dopamine, ADHD, narcolepsy, and binge eating disorder. If adverse effecting nervousness, agitation, anxiety, insomnia, anorexia, tachycardia, hypertension, weight loss, tics, and bruxism can happen. And that's all about the drugs and psychotherapy. Hope you enjoyed.